Dr. Robert Lelouch, a board-certified OBGYN physician with over 30 years of clinical experience. And today I'm going to go over some broad bits of information that'll help reduce your risk of a miscarriage. Perhaps you're thinking about getting pregnant, you've never been pregnant before, and you certainly want to do all that you can to have a great, healthy outcome, or perhaps you've already had a miscarriage and you're looking for more information. If that's the latter is your case, be sure to consult with your physician for some particulars for you, but this general information certainly will be of use. First of all, if you're thinking about getting pregnant, it's good to start taking prenatal vitamins with folic acid. Having those vitamins in place, having adequate folic acid levels will help reduce your chance of having a miscarriage and reduce your chance of having a baby with birth defects. Also, if you're a smoker, smoking does increase your risk of a miscarriage. And I strongly encourage you to get some help getting over smoking. It would be tremendously helpful to eliminate that from your life. There's another video showing separately all the harms of smoking during pregnancy. And for those of you who are wondering, that does include marijuana. So there's all kinds of conflicting information on the internet about whether or not marijuana is of use for nausea. Certainly there is some benefit in nausea, but I definitely do not recommend that during pregnancy. It does increase your risk of miscarriage. There's all kinds of unknowns with the newer, more potent marijuanas that are available now. Potential links to mental health issues in babies. So I definitely I'm in the camp of avoiding that during pregnancy, and also to reduce your chance of a miscarriage. Alcohol. Well, as you can imagine, many babies have been created as a result of a little excess alcohol. So early on, there hasn't been shown to be effect. However, during pregnancy, alcohol is the #1 cause of mental retardation throughout the world. I encourage you, if you're actively trying to get pregnant, to limit your alcohol, and as soon as you, to severely limit your alcohol. As soon as you find out you're pregnant, certainly discontinue drinking alcohol. Also, it's good to have a screening exam. There are infections that are correlated to miscarriage. Some more unusual bacteria like ureaplasma, uroleticum, others that might just give you irregular bleeding or spotting. So it might be worth getting that checkup if you're noticing any discharge or slight discomfort or irregularities in your period. So those are all of value. You also need to do a medication review. There are actually very few medicines that are strongly linked to miscarriage. For example, methotrexate, or some acne medicines. Accutane's a brand name that's off the market, but there are substitutes for it. But some medicines that are for depression or other psychiatric illnesses are correlated, perhaps less strongly, but if you're on any medications, it's a good idea to have a review with your physician and know before you get pregnant what you should do, how they can be adjusted. So that would be a great use as well. Also, if you have polycystic ovary syndrome or diabetes, those are certainly, there are other illnesses that are related that can increase your risk of a miscarriage. So for polycystic ovary syndrome, exercise, do your best to get your weight in good control, can certainly improve your outcome, especially if you can get your BMI under 30, but especially under 40 will have a significant benefit. That's a calculation based on your height and your weight. You can get it on the internet or speak with your physician about that. Diabetes certainly needs to be in good control. Your hemoglobin A1C wants to be as optimized as possible. there is a strong correlation with how high it is and birth defects or miscarriage, especially with an A1C above 8. So I definitely recommend that you get a review with your doctor and work hard to get that under control. There's differences, significant differences on whether or not you have type 2 diabetes or type 1 diabetes. Also, hypothyroidism. If you have a thyroid issue, that needs to be under control. If it's really far off, then it can interfere with your ability to get pregnant. However, if it's only slightly off, then it could lead to miscarriage or birth defects as well. So it's important to have that under control. And if you have low thyroid, and for example, you're on medicine called Synthroid, then you might need more, not less. So that's not a medicine to avoid. You want to stay on that with pregnancy. Again, check with your physician beforehand. So those are some general tips. Exercise, we encourage exercise. Extremes of exercise are not very good. So if you're training for the Olympics, probably not the best time to try to get pregnant. On the other hand, no exercise is also detrimental to you as well. Keeping near a good body weight for you is helpful. Getting adequate rest, sleep deprivation is not good in many ways, but it's important to improve your health outcomes, and your body is attuned to that for getting pregnant and maintaining pregnancy. Having enough rest, avoiding drugs, alcohol, appropriate balance of diet. There's another video I have on foods in pregnancy, so getting healthy eating, fish, for example. There's some new questions on whether or not you should even avoid some of the classic fish that they've mentioned. You need to get the latest information, but salmon's always good. Fresh fish is good. Tuna in moderation. Tuna's a big fish. It eats a lot of small fish, builds up mercury. There are some data suggesting that there hasn't been a problem with that, but I would do everything in moderation, so no more than 6 ounces per week. But look for latest information. This video is made in March of 2023, and there is some ongoing information. So again, verify with your physician, but once you're pregnant. I hope you found this useful and informative, and I'll make some other videos related to this. Please leave your comments. We appreciate it. Thank you.